You're lying on the floor of a cave in Borneo, 31,000 years ago. You're young, maybe still a child, and the lower part of your left leg, shin and foot, is gone. Not torn off by an animal, not crushed in a fall, cut off, on purpose, with a sharpened stone, by someone in your own group. There is no anesthetic, no antibiotics, no clean water as you'd understand it. By every rule of the world you live in, this wound kills you. The infection alone should finish it within days. And yet that child lived. For another 6 to 9 years, on one leg, in a rainforest, until they died of something else entirely and were buried, carefully, in that cave. We know all of it from a single skeleton, lifted out of the ground in 2020. One body, that pushed back the oldest known amputation by 24,000 years. So here's the question this whole video is built to answer. How did human beings survive injuries that, without a modern hospital, would still kill most of us today? No stitches, no pills, no sterile anything. The answer is older and far stranger than the one you were taught. To feel how impossible that is, you have to understand what a wound used to be. For almost the entire human story, the deep cut wasn't the real danger. What came after was, a scratch could turn septic. A clean break could kill you slowly from the inside. The first true antibiotic didn't exist until 1928, meaning that until less than 100 years ago, every serious injury was a gamble with your life. So how do we know who won that gamble, tens of thousands of years later? We read it in their bones. A wound that kills leaves bone with sharp, raw, unfinished edges. A wound someone survives does something unmistakable. The bone slowly grows back, smooth and rounded, sealing the damage over. That smoothing is a clock. It tells us, beyond argument, that this person lived. And a startling number of them did. Begin with what was simply growing around them. The first medicine cabinet wasn't a cabinet at all, it was the landscape. Take the willow tree, strip its bark, and you're holding salicin, a bitter compound your body turns into salicylic acid. If that rings a bell, it should. It's the chemical ancestor of aspirin. Sumerian clay tablets and the Egyptian Ebers papyrus, both more than 3,500 years old, recommend willow for pain and fever. They had no idea why it worked. They just knew, by trial and burial, that it did. It took until 1828 for a chemist to finally pull salicin out of that bark, and 70 more years before a German company pressed it into the small white pill in your bathroom. Then there's yarrow. Its scientific name, Achillea, comes from Achilles, the warrior who, in legend, used it on his soldiers' wounds. For thousands of years, people called it soldier's woundwort and packed it straight into open cuts to slow the bleeding. Plant by plant, our ancestors were running a pharmacy they couldn't read the label on. And here's where it turns genuinely strange. Because the ones doing this weren't always people like us. Around 50,000 years ago, in a cave called El Sidrón, in northern Spain, lived a group of Neanderthals. Not our ancestors, our cousins, a separate kind of human. When researchers scraped the hardened plaque off their fossil teeth, plaque sealed in place for 50,000 years, they found the chemical fingerprints of yarrow and chamomile. Bitter plants. Almost no calories. So why chew them? One individual makes that question hard to wave away. His teeth held traces of poplar, a tree that, like willow, carries salicylic acid, the active ingredient in aspirin. And alongside it, a mould from the penicillium family, the same group of fungi that later gave us penicillin. This same man had a painful dental abscess and a stomach parasite. So some researchers argue he was treating himself, a natural painkiller and a natural antibiotic, 50,000 years before the first pharmacy. Others say the plants reached his mouth by accident. That debate is genuinely unresolved. The chemicals in his teeth are not, now moved to a body we can actually stand and look at. In 1991, hikers in the Alps found a corpse melting out of a glacier and assumed it was a lost climber. It was a man who died around 3300 BCE, 53 centuries ago, and froze so fast that his stomach, his tattoos, and his final meal all survived. We call him Ötzi. Ötzi was carrying a kit, and threaded onto a leather cord he had pieces of birch polypore, a tough fungus that grows on birch trees. It isn't food, but it contains compounds toxic to one very specific thing, intestinal whipworm. And when scientists examined Ötzi's gut, that is exactly what they found. Whipworm. A man crossing the high Alps 53 centuries ago, carrying the one fungus that fights the parasite living inside him. No one can prove he understood the connection. But it is very hard to look at that and call it luck. As far as the evidence goes, he was carrying his own medicine. But not every wound has an answer hidden in a plant. And this is where survival stops being about chemistry and starts being about each other. Go back again to roughly 50,000 years ago, to Shanidar Cave in the mountains of Iraqi Kurdistan. There lived a Neanderthal man. Scientists simply call Shanidar 1. His skeleton is a catalogue of disaster. A crushing blow to the head had likely blinded his left eye. His right arm was withered and ended in a stump, lost at the elbow. His right leg was damaged, leaving him with a heavy limp, and bony growths deep in his ear canals would have left him almost completely deaf. Blind on one side, one working arm, deaf, limping. In a landscape full of cave bears and other predators, he should have been dead inside a month. Instead, every single one of those injuries shows healing. He lived into his 40s, genuinely old for a Neanderthal. He could not have survived alone. Someone fed him. Someone listened for the danger he couldn't hear, for years. Survival here had a face. It just wasn't his own. Which brings us to the hardest thing of all, cutting into a living human body and having it work. Across the Neolithic world, in Europe, in Peru, in China, people performed trepanation, scraping or drilling a hole clean through the skull of a living person. It sounds like an execution. It wasn't. At some sites, 70 to 80% of trepaned skulls show the bone healing back. The patients lived, some through 2 or 3 separate operations, at survival rates that matched or beat European surgeons in the 1800s. And then there is that child in Borneo. 31,000 years ago, someone cut through their skin, muscle, nerve, and bone to remove a leg and kept that wound clean enough, in a jungle, that it healed. Surgery, something we assumed arrived with farming 10,000 years ago, was being done, and survived, in the Ice Age. So go back to your bathroom one more time. Open the cabinet. There's a bottle of painkillers in there. Small, white, utterly forgettable. You never think about it. But hold it for a second, because of what it actually is. The active ingredient in that aspirin is salicylic acid, the exact compound in the willow bark the Sumerians wrote about 3,500 years ago. The same compound a Neanderthal may have swallowed, in poplar, 50,000 years before them. We did not invent it. We rediscovered it, and finally learned its name. That bottle isn't the start of medicine. It's the most recent line in an experiment that has been running for 50,000 years. Written in bitter bark, in birch fungus, in bone that grew back over a wound that should have won. That forgettable little pill was, for almost the whole of human history, the line between living and dying. We didn't cross that line by being cleverer than them. We crossed it by remembering what they already knew. If this changed the way you see your own medicine cabinet, subscribe. There is far more buried in these bones than any of us were ever taught.